In our previous presentation, we described how the two hearing systems work and how their dysfunction can cause tinnitus. Tinnitus can result when either of the two systems dysfunctions, or when the two systems combine to cause tinnitus. In this second presentation, we are going to describe the ways by which the tinnitus can be quieted. We will draw upon the principles that were developed in our first presentation, where we described how tinnitus develops when there is a disturbance in either of the two hearing systems. Recall that the most common way tinnitus develops is from hearing loss. Specifically, with hearing loss, typically the inner ear and hearing nerve become underactive, but paradoxically, the brain's first hearing center becomes overactive because it is not receiving its usual stimulation. It is this overactivity of the brain's first hearing center that is perceived as tinnitus. So, if the underactivity coming from the ear can be improved to some extent, then the tinnitus can be quieted to some extent. This is how hearing aids work to quiet tinnitus. Hearing aids increase the activity reaching the first hearing center of the brain, which, in turn, decreases the overactivity of the brain's first hearing center. Since tinnitus is due to overactivity of the brain's first hearing center, the decreased activity of the brain's first hearing center quiets tinnitus. Studies have found that with two hearing aids, one in each ear, more than 2/3 of people had their tinnitus improved by more than 50%. With one particular kind of hearing aid, more than 10% of people did not hear their tinnitus at all. Now recall that there is a second part of our hearing system originating from the muscles, tendons, and joints of our head and neck. Nerves from the head and neck then go to the brain, including the brain's first hearing center. Dysfunction of this system is another major cause of tinnitus. One of the ways that muscles, tendons, and joints of the head and neck dysfunction is from neck strain or jaw strain that leads to the development of tender, focal, hard areas in muscles. These tender, focal, hard areas in muscles are called trigger points and can cause tinnitus. Trigger points can be caused by a variety of things, but most commonly it is from stress, injury, or long hours at work. Treatment of these trigger points often quiets tinnitus. In our experience, the most effective way of treating trigger points is by deactivating these trigger points with very thin acupuncture needles. Unlike acupuncture treatments, these needles are directed toward the trigger points that are located within the muscles. We refer to the procedure as dry needling of trigger points. If the dysfunction involves jaw muscles, then a dental assessment and treatment of the bite, usually with a bite guard, is recommended. Use of a bite guard when combined with dry needling can be very helpful in relieving the muscle strain that is causing the tinnitus. Just recently, it has been appreciated that another way the neck can dysfunction to cause tinnitus is from arthritis involving the joints between the bones of the spine. The medical name for these joints is facet joints. When a facet joint is dysfunctional, we refer to the condition as facet arthropathy. Treatment of facet arthropathy is by a procedure known as facet blocks. Facet blocks can abolish tinnitus. A third way of quieting tinnitus is related to the fact that, beginning with the brain's first hearing center, tinnitus is due to overactivity of the brain's hearing centers. The nerves of the brain communicate with each other by using chemicals. Some of these chemicals increase nerve activity, and other chemicals decrease nerve activity. These chemicals go by the name of neurotransmitters. Since tinnitus is related to overactivity of the brain's hearing centers, making stronger the chemicals that decrease nerve activity will decrease the activity of the brain's hearing centers and thereby quiet tinnitus. Consistent with this principle, multiple studies have shown that in about 75% of people, their tinnitus quiets, and in close to 10% of people, their tinnitus is totally suppressed when they take medications that enhance the neurotransmitters known to reduce brain nerve activity. To summarize, the way tinnitus is treated will depend upon what appears to be its primary cause. If the primary cause is related to hearing loss, then the first line of treatment is hearing aids. If what is causing tinnitus is primarily related to dysfunction of the head and neck muscles, then the first line of treatment is dry needling of trigger points combined with dental therapy. If these treatments are not sufficient, then the tinnitus is treated by facet blocks to the joints of the spine. Medications can be used to quiet tinnitus no matter what the cause. We hope you've enjoyed our presentation. If you live in the Tel Aviv area and would like to receive treatment, or for more information about our staff, please visit us at www.tinnitushome.com. Thank you.